Okay, so I understand that quite a lot of risk factors during exercising no exist in cardiopulmonary rehabilitation, and I understand we have a very wide range of practitioners here. I want to know how each one of you try to manage the emergencies that you anticipate in your practice. We can start with Dr. Cheryl.
Hello, yes. So basically, we need to be certified in basic life support and also, if possible, in advanced life support.
Truly.
Yes, that's the first thing. Then there are some emergency tools like CPCR equipments which you need. You need to be well equipped with that. Along with that, you need to have a cardiologist in case of emergency. You need to have a collaboration with them, as already mentioned. Few hospitals in the vicinity. What I would also say is contact numbers of the ambulances, there are cardiac ambulances, so that in case of emergency you have all the things mentioned, all the contact numbers mentioned. So that is really important. And emergency medicines also need to be taken care of, and of course risk assessment and all has to be done before you start up a rehab for the patient. But at the same time you need to be well equipped with all these things. Yes, thank you.
Yes, I think BLS and ALS, I think BLS certified at least, right? I guess all of us have to be at least BLS. That is, I think, mandatory that we should be BLS certified. So we should be able to help certain individuals until the help arrives. So, and I think it needs, correct me if I'm wrong, it needs like a 2-year renewal, I guess. So every 2 yearly you will have to renew your BLS. Yeah, right. So it has to be like renewed every 2 years. And of course, you should have ours is a different setup because we already had a cardiologist on board. So we had a defibrillator and we had all the emergency equipments in-house. But yes, I understand when it's a completely outpatient setup with nobody around, then yes, you need to have a backup with a cardiac ambulance and nearby hospitals. But I think Cheryl and Sejal would be more, they can enlighten us more about it.
Yeah, Dr. Sejal.
Yeah, so I think Cheryl has listed most of the thing. Apart from that, I think if you have a staff, then the roles should be pre-discussed. That at the time of emergency, you can't think about who is going to do what. So
like a courtroom.
Assigned roles should be there, that one person is going to take care of the patient, the other one is going to call the ambulance or the relative and take it forward. The second thing I would like to mention is how to prevent the emergencies. That counseling needs to be done beforehand. So when the patient is coming to you in the first consultation itself and taking the rehab sessions, you should counsel them that they have to take the medications on time. If they're not feeling well, they have to inform and avoid the session on that day. Also, when they go to the regular checkups, and if there is any change of medication or anything, any new medical test has been done, then that has to be reported and documented in our proforma as well. And
I'm sure that you all are very, very doing the right practice of taking consent
forms.
Yeah, that is very important. And a relative signature on it is also very important. So it's mandatory that at least in the first consultation they come along with a relative or a caretaker, so that the consent is also taken signed by some third person. Yeah.
You have really mentioned a very, very valid point when we talk about the emergency to take up informed consent. That's for the safety of the private practitioner and also the patient too. Yeah, and I think right now, I want to know from Dr. Purvi, we are at the end of maybe, I don't know, of the COVID pandemic. How did it affect your practices, Dr. Purvi?
Yeah. Actually, it was a positive. It was a positive thing for us. After like 8-9 years of pulmonary rehab, patients were very happy coming to center and doing exercises, and suddenly everything stopped. So we need to think something for them, because we cannot waste whatever improvement we have got through over years, and they are doing and continuing the things. So we thought of a tele rehab, or you can say the web based rehab for these patients. So when the lockdown was announced, so immediately we shifted. Within 2 to 3 days we planned how we are going to start continue our rehab on tele rehab. And we informed each and every patient that it is going to be difficult, but we are there to help you anytime. And we shifted them in a tele rehab program, and like since 2 years they are doing tele rehab. And the patients who are still very old and they cannot come to the center, even though we started physically, so they are still continuing with tele rehab with us, and now they don't want to leave that tele rehab thing. And definitely after COVID, and when we understood that post COVID rehab is very important, we started tele post COVID rehab also from the month of 2020, July and August, we started post-COVID rehab also. So
even the challenges of pandemic has paved way for newer ways of practice, which has again proved to be successful.
Can I ask Purvi a question?
Yeah, sure.
I think what about the consent form when you are doing tele rehab? I think we should kind of say something about that too.
Yeah, so for the consent, so we had a brainstorming session with our team that how we are going to take consent for at least post-COVID patient, tele patient, because other pulmonary patients were our old patient, and we had consent, and they were ready for and they were stable. So we don't have to worry about those patients. But for post-COVID patient, it was a big challenge. So what we thought that we have a proper format that they have to audio record and send it to us, and then we save it in our system. So that was a verbal consent on an audio, because it was, and otherwise the second option was whatever consent form we had, we used to send it on a WhatsApp. They can sign and then scan and send it back. But the verbal was more effective, and everyone was doing that verbal consent.
Probably who is not very well versed in technology, and who don't have access to internet printouts.
Right.
Yeah. That's nice. That's a very valid point. It will be helpful for most of us. And I want to know about the staffing. Is it not? It's not just enough. It's not a one-man show. No. So I want to know, how do you manage with the staffing, and what do you look for in your physical therapist when you hire them? Dr. Cheryl, how do you manage it?
Yes, so basically I started a year back, or not even a year, like, I'll be a year in May. So to start with, I'm the only, it's my own setup, so I'm the only cardiorespiratory physiotherapist working. But if you tell me, in actual, there's a full team which is with me working. Like physically, I'm present there, but I have, the dietitian with me, a psychiatrist in case of the patient needs a psychological support, the pulmonologist in the team, the other physicians in the team. Okay, so basically I would say, to begin with, when we study, when we work, when we do our masters, we think we are the only person, rehab is only about exercise. But I would say, when I realized it, I would share my experience. Initially I didn't collaborate with a dietitian. I used to tell the patients, that please consult the dietitian, whichever dietitian you're comfortable with, or if it will be better. But then I realized over the time that diet plays a really important role, and you need to be very focused on it. So then I collaborated with a dietitian, and I do advise my patients to have an online consult, considering the pandemic, because it's not possible for being a small setup. It's 300 square feet, I can't actually call the dietitian there, every time, travel back. What I do is, I advise them to take an online appointment, have a consult, and only then we proceed, like the first consultation with me, then the dietitian, and I'm also in contact with the dietitian. So for I do work alone in my setup as of now. There are physiotherapists who are asking me to join in, so maybe in the coming months. But then as a team, in my mind, there are different specialities working together for the same patient. And as you said, following up with the patients, at the same time updating the physicians about how is the progress. So basically, if I tell you, if a pulmonologist refers me a patient, I assess him, I give him an enrollment report. That's what I realize now, because it's difficult to communicate when there are different doctors working at different setups, or else an assessment report to see how the improvement is, or else a WhatsApp message if the physician is quite comfortable, discussing it on a WhatsApp or a call. And same goes with the dietitian. So I think it is a teamwork. You have to consider all the factors. And if you have a staff, you need to assign them roles. And as Dr. Asabari would be doing really great in that. Yes.
Yeah, that's a very important point in teamwork. Dr. Asabari, can I know about the staffing pattern in your center?
So since it was a joint venture and we have a huge staff, so we have a nutritionist, we have a counselor also, so stress management. So the entire program is a structured program wherein a person, once he or she is referred, goes to a counselor who actually counsels the patient about the packaging, the finances, about the rehab program, the team members in it, and how things would run. After that, the person enrolls and starts coming for exercises, but also has an appointments with their nutritionist, with their stress management counselor, with the in-house cardiologist if he has, or a person who's referred from the other cardiologist and he goes back to his own cardiologist. But we have a nutritionist counselor. We also have someone called as what they say, a laughter session thing. So he's like a consultant to us. So they come like once a month for the group, and they take a laughter session, like a stress management session for them. So
would love to come to your centers, each one of your centers, to see that.
Yes,
the functioning of it.
Thank you.
Okay. Yeah, I want to know, I come to know that you have no consultants, different consultants like dietitian, cardiologist, and everybody with you, psychologist, etc. How do you manage the package? Do you have a package for each of the patient? Because it's going to be a long-term setup. Dr. Purvi, how does it go with your center?
Yeah, so when we started, we were thinking about how to charge them, and as we knew that it is a long-term process, and if they come for maybe a month or two, then only we will get any improvement. So that time we thought that it's better to keep package rather than doing session per session charges. So that's how we started 2 months package, and then while considering patients' financial conditions, sometimes we used to give discounts also, because we need to consider that. That's very important. We cannot be very corporate style, or you can say very professional in that. So that was a thing. And while keeping charges, depending on the area where you are working, so which suburbs you are working, whether it's a metro city, or if it's a two-tier city. So depending on that area, you have to keep the charges and what is their financial capacity to pay. And because it's a long term, we cannot keep exorbitant charges. And so packages are like not very high. Charges were not very high initially, and then once you are set up with your practice, and once you are seeing the improvement in your number of patients, then slowly maybe down the line you can increase charges for the packages.
Okay. Dr. Shejal, we have talked about our practice, our setup, etc. But how do you manage your work life as an entrepreneur?
I am fortunate to have a very supportive family. My parents, my in-laws, my husband, they are all very supportive. So, it's very fortunately easy to balance. Now that I have a month-old daughter, again, I'm getting a very good support from the family, and also have one physiotherapist. She's also cardiorespiratory physio. She is taking care of the clinic, and I'm taking care of the online sessions. So, in a way, it's going on well. But at the end, when there is a will, there is a way.
Challenges as a woman working both at home and in your private practice. I understand private practice works well only in the evenings, where we have to be at home to take care of the home and the kids. How do you manage it?
I think it is definitely a a good point, because all the women, I guess all ladies would face these issues where you have to manage your family at the same time, your work. I have got 2 kids, and I think a huge support system is very, very, very important. Family support, my husband, my in-laws, my parents, everybody have to be really supportive. When I need to go, I just have to pick up the kids and send it to my either mom and mom-in-law. So it's extremely important to have a support system, I guess, without which it's not possible.
And ma'am, I think support system from the workplaces also matters. Like sometimes because of the personal issues, we are late.
Oh yes, that is also important.
Very important. Like,
yes,
if your staff is understanding and helping, cooperating, then it's you can run the show.
Yes, so at sometimes we can actually take our kids to the workplace, make them sit there when you are that should be really good. I do that.
In COVID time, like when we did tele, and that was very difficult time when you had to do tele and housework and everything. But yeah, definitely family matters.
Yeah, it used to be all 24/7 for all of us. All right. So we were discussing about the hurdles as entrepreneurs, and what do you think are hurdles of patients in a private to attend a private cardiopulmonary physical therapy session? Yeah, I see. Dr. Sejal, I see a hand raise from Mitty.
Yes, ma'am.
Yes, please.
Ma'am, actually, I have 2 questions. Is that okay?
Yes, please. Please carry on.
Okay. I first of all, thank you so much. I'm really glad I could be a part of this live audience. I actually wanted to know that how important is to have basic investigation equipment like an ECG or PFT. So, is it better to have it in your own setup, or do you prefer that you refer it to other setups for regular investigation checkups?
Would I like to, should I share in this?
Please.
So indeed, this was the first question in my mind too. But when it comes to PFT, I suppose the patient is first consulting the pulmonologist. The PFT is done itself at that place. But I had few patients who had just come from word of mouth, So I made a point that I refer them to a pulmonologist. So most of the times it was, the opposite way, I did refer many patients because for a proper consult and a proper diagnosis of the condition, only then we can proceed. So that's one thing. About the ECG, yes, telemetry is really an important thing. But for me as a person to start with, I had no idea what type of patients I'm going to get, how much are they going to be patients, because I didn't get a very great response in the initial from the cardiac part. And for me, myself, I was not really confident. But then what I thought was, you get a portable ECG, machine where you can actually train yourself to get an ECG done. Or else you also get few devices. Of course, they are not that great valid like telemetry. Telemetry is an essential thing. But to start up with, there is Dr. Trust, there's a monitoring, ECG monitoring thing. So, or else, of course, consult with a cardiologist if you need an ECG done on a regular basis or, after sessions. So it is important. Yes.
I think I would like to just add, yes, of course, we have everything in-house, but I guess you really don't need an ECG, like a 12-lead ECG. If you have a telemetry unit, which is also a necessity, but at times, yes, you can do without it. But I don't think you really need a 12-lead ECG or a lab. You can always refer that to someone, because most of the times when patients come to you, they already have their recent ECGs. You would only need a 12-lead ECG when your telemetry you're doubting your telemetry reports, because telemetry usually shows you 1 or 2 leads. It will not give you a 12-lead ECG. So it may happen that you have a little doubt in what you're seeing, or you may have a little doubt in what you feel. But at an outpatient facility, when you are on your own, I think any doubt has to be just worked on like quickly. So I don't think that it would be a wise decision to wait and go and get a 12-lead ECG yourself done to see what it is. Just refer the patient to an adjoining facility.
Yeah, I hope they answered your queries, Miti. Are there any more queries?
Yes, yes, ma'am. Actually, I wanted to know that are there any specific guidelines for infection control, as if we are dealing with pulmonary and cardiac patients, for that matter, any patient who is at high risk. So, how do you deal with infection and infection control?
Ma'am, can I answer this?
Yes, please, Dr. Purvi.
Yeah, hi Meti. It's a very valid question and a very good question, because when you are dealing with the pulmonary patients, mostly sometimes like we do have bronchiectasis patient or cystic fibrosis patient. So you first thing, it's very important. Actively infected patient you should not take when there are other patients around, and you can plan the visits when individually you can plan the visits. And when we are practicing rehab, when you have a small setup, it's better not to take active infected patients. And second thing, what we consider is like, as that IRD patient and fibrosis patient, they have this dry cough. So that time to educate other patient is also important, because they feel that this cough is infective. So that education is also important. And then you have to keep different toilets and different cleaning areas for the patient, so that whenever they want to just remove their phlegm, or that time those hygiene things we have to maintain. Like, we cannot do chest PT when 4 patients are there in our OPD and we are doing chest PT in the same surrounding. So it's better to avoid those patients. And even if we want to do that thing, call them at the time when there are no other patients, like when it's an empty place. Or you can just, if you have a big area, then you can just isolate that place where you can do chest physiotherapy, or when patients who are actively infected.
So Dr. Purvi, have you actually laid down protocols like infection control protocols? Because I think what you're saying is extremely important.
Yeah, so we don't have actually a protocol for infection control, but we have basic guidelines for our clinic. Like, actively infected patient, we don't take. And even if it is very important, and if the physician has referred for this actively infected, then we make it a point that we call them when there is no one. That those guidelines we follow. And even if the patient, even if a normal patient like COPD, and if we find that this patient has exacerbation or active infection, we tell them to go back to their physician, take the treatment, and then again come.
Okay, that's a very important clinical tip. I hope we have answered your queries, Meti. Any more queries?
Yes, ma'am.
I just wanted to add one thing. In this infection control, due to COVID, we also sanitized everything before and after the patient comes. And we used to take only one patient at a time. So to avoid cross-contamination, and all the equipments, treadmill, cycle, wherever the patient is likely to touch, all the places, all the equipments were sanitized after the patient leaves.
All right. Yeah, thank you. I hope we were discussing about the hurdles that we face from the patient side. Dr. Purvi was on it, if I'm not wrong.
Yeah.
Can we have very quick?
Yeah. So the hurdles were, first very important thing was the transportation for the patient. That was the first hurdle. So for that reason, we need to have coordination with other setups also. So we have to work as an integrated pulmonary rehabilitation therapist. So if the patient is coming from very far, then refer them for nearby setups. Or second thing, now post-COVID, as we started with the tele rehab and a web-based rehab, we call them for assessment we teach them the exercises and they continue on a tele-rehabilitation sessions. So that was the first thing. And second very important hurdle in our patients was they were coming, they were completing 2 months, and then the follow-up was not there. That was a hurdle. So how we overcome it? Like we used to call them once a month, and we used to call them. Telecommunication was very important. So they feel the importance that, doctors are calling us to know how we are feeling and how is our progress. So that was very important. And that's how we started with, follow up with the patients, because long term, as we see the new definition of a PR that says the adherence and the maintenance is a very important. So, and for that reason, we started with patient education sessions online. So we are sending them links, and, once in a month, we are doing patient education sessions online. So they are facilitated for continuing their PR.
Thank you, Dr.
Can I share?
Yes. Yes, sure.
Yes. So basically, even I was facing a problem of follow-ups and, how to keep in contact, because when you're just the alone person starting up, you need to have so many things in mind, how are they going, what is happening, and, but then I realized about the support groups and singing for lung health. So basically, my clinic setup has done a lot of camps, webinars, initially also for students and at the same time for the patients. So what I realized was, suppose we had a session on singing for lung health, we did invite a few musicians, few singers, and we also invited our patients. I remember there were few patients who were not very great at following up, but when this things came, it was really exciting for them. At the same time, the support group,
Exactly.
We didn't have a great number, but then that was something which kept them going. And I remember the patients coming back and understanding the need of continuing the rehab. So basically, the motto was not telling them, the motto was bringing them together for a purpose, so that it helps them. So all these things, the small little things, I think you need to work on. It will take a lot of investment. I remember my evenings just going into these things, and I'm not going out, and but there was some joy to have those patients together and follow up with them. I think that's rehab what is about.
Yes, activities. I think she mentioned a very good point. Activities is what we have to keep doing. Certain group activities and
creative too.
Creative too.
Yes. And entertaining.
Yes.
Not
so we used to
much.
do a lot of cycling activities, some group sessions. I remember right from the Dinanath days, I used to have at least one session of group activity every Saturday. And that has been continuing since so many years. So because all the other time people come individually, do their sessions, go back, they don't meet all the batch people. So this is one day where they get to meet all of them in a group where they're not using any machines and they're doing all floor activities. So that is again, like the group activity sessions are something which will keep them motivated to come.
Exactly.
And yeah.
I just want to add last thing that apart from exercises, we used to celebrate our annual programs where they used to perform, not only singing, dancing and everything, like Patient with Oxygen, they had danced. So last annual program was in 2020, March 8th, and then it stopped. So still people are asking that, when that program is going to happen. So that helps.
Annual programs help.
Yeah. Thank you all for sharing your views. Now I open the floor for the other people, to the audience, to raise your queries. Do we have any questions from the audience? You can just raise your hands. Yeah, this was a very comprehensive and very nice interaction from the actual entrepreneurs. Thank you, ladies, for an interesting conversation and sharing your experiences, which are very, very valid and very useful for all of us. I hope this discussion may pave way to a lot of other advancements too. Like, for example, it's a dream, like it will be an inspiration for a fellow therapist to venture a private practice, physical therapy practice, or to set up a OP cardiac rehabilitation center as such, or a center to cater for immediate cardiorespiratory emergencies in your own locality. That's a must, I feel. Okay, back in US, they say the help arrives in 10 minutes time wherever the emergency is. I think by setting up such private practices, the center can be, one point of time can be accredited as a center for emergency practice for nearby people. I hope your centers will grow something like that. And so these are our hopes and dreams, which may become a reality very soon. All the best to all of you. And thank you to Dr. Razia for organizing such a panel. Thank you, audience.
Thank you for
Thank you.
Dr. Rucha.
Thank you, ma'am. Thank you so much for chairing the session so beautifully, and it was conducted in a very streamlined manner. A big thank you to all our panelists for sharing their personal experiences. I believe the content of this discussion is not something that you get through books. It's all based on what happens in the real world, and your inputs definitely have, inspired and guided budding physiotherapists to kind of take their dream and, go ahead with it to actually have a cardiopulmonary setup. So thank you once again to everyone. And I loved how there was a focus on important points like communication, patient education, importance of facilitating adherence through, creative activities, documentation, teamwork, and not just a holistic approach in terms of patient care, but also as, family support, everything. I think this discussion covered so many aspects in such a short duration of time. You guys were amazing. So thank you once again. And thank you to all our viewers for attending. I request everyone to stay tuned. Our next session will be beginning soon. Thank you once again.
Thank you.
Thank you.
Thank you.
Thank
Bye.
you so much.